Okay, so what can a lip lift do and what can it not do?
So it's super common to see people come in. They go, I haven't had that much filler done, but it's probably all spread from their lip into their white lip. And they now have a thicker lip and it has a certain look to it. The lip almost seems like it's malpositioned. It's come anteriorly. The configuration of the lateral lip relative to the base of the nose seems to be distorted. They often have some filler in the red lip.
So is the upper lip is supposed to be smaller than the lower lip? Because some people,
It can be up to 50-50 type of thing, but you don't want the upper lip to be bigger than the lower lip.
Okay.
In the old days, the incision, and some surgeons still do it this way, goes right into the nose. We typically follow the shadows of the nose as close to the nose as possible to not violate or change any of the nasal anatomy.
I think that's my least favorite procedure.
Which one?
The corner lip lift.
You've had it done, or
I have not had it done.
So why is it your least favorite?
It's my least favorite.
Why? Welcome back to Unfiltered. Today we're going to touch on a topic known as lip lifting, and we're going to talk about a few highlights about that operation to hopefully give you some more information and see whether you think you're a candidate.
So I compare this procedure to putting on lipstick. It just gives the face a little lift. It's a small procedure that does quite a bit. So I thought we can discuss it, and let's also talk about the different terminology for the lip lift and what it can do and what it cannot do. So Let's start with, what is a lip lift?
So a lip lift is a surgical procedure. There are different ways of doing it. The most conventional way of doing it is known as a subnasal lip lift, and that means the incision is just below the nose. So an incision is made like just at the bottom of the nostril, following along the natural curvature of where the nose meets the upper lip. That's known as a bullhorn incision. In the old days, the incision, and some surgeons still do it this way, goes right into the nose. We typically follow the shadows of the nose as close to the nose as possible to not violate or change any of the nasal anatomy. And then different measurements are done depending on a patient's anatomy to determine how much lip lifting is required. The practical considerations relate to the amount of lip lifting you require, typically to show more of the upper red lip, to shorten the white lip, and to provide some more dental show, meaning you can see more teeth. So in someone who has a long lip, someone who has limited...
So a long lip meaning the white lip. This area is called the white lip.
Yeah,
so
correct.
That's the long.
Yeah, the lip from the base of the nose down to the red lip.
Mm-hmm.
It could be white, it could be round, it could be black, but it's not the red lip. So everything from the base of the nose down to the red lip is the area that we're talking about. And if it measures a certain length, usually over about 2 centimeters in length, you may be a candidate for that surgical procedure. Other considerations relate to age. Second thing to consider is amount of dental show. And third thing is if someone smiles and their anatomy shows when they smile some dental show or gum show, then you have to be conservative of whether you do the procedure, because you can end up making a patient have a very gummy smile.
So the lift is as wide as the nostrils. It doesn't go beyond that. So that's just the central lip, correct?
Yeah, correct. So this is going to be lifting more of the central lip than the lateral lip, and that's why there's some limitations of procedure. If a surgeon were to excessively if someone were to excessively lift the central lip and the patient had a relatively wide mouth and a narrow nose, you may end up a situation where the central lip looks a little bit like a bunny rabbit, where the middle part is lifted up, teeth show, and not that much of the lateral lip shows. So some cases we have to consider the anatomy, the width of the mouth, the width of the nose, the scar placement, how much lip you can lift conservatively, not to create a distortion or a bunny lip or too much dental show or gum show. And in some cases, we add in what's known as a corner lip lift, where a separate incision is made right on the lip, which extends just beyond the corner or the commissure of the lip and lifts the lateral aspect of the lip as well. I do that occasionally on patients from the beginning, but frequently we'll stage it and do the central lip lift, let everything settle in, and then do a corner lip lift as a staged procedure later on.
I think that's my least favorite procedure.
Which one?
The corner lip lift.
You've had it done, or
I have not had it done.
So why is it your least favorite?
It's my least favorite.
Why?
It's the least, I just think the risk of the scar, and it's usually often young women who want that procedure. I don't love that procedure. I don't love the risk of the scar.
Well, that's why we stage it. I would say that most lips heal pretty nicely. You lose a little bit of the roll of the lip, the vermilion border, can be distorted very slightly on the lateral lip lift. But I would say in an older patient who's having, for instance, facial rejuvenation surgery, a facelift operation, potentially laser resurfacing, a lip lift and a lateral corner lip lift sometimes can make dramatic changes to their overall appearance of their face and can make someone look radically younger. So I agree with you. Like typically I'd say we do corner lip lifts on only 10% or less of our patients because of the risk of scarring on the lip. But I would say that we've taken a lot of photos of patients with corner lip lifts, and the scar is very hard to see in most cases. But I agree with you. The patients probably should avoid that scar unless it's absolutely needed.
Exactly. Okay, so what can a lip lift do and what can it not do? So it can shorten the white lip. It can increase the size, the volume of the upper lip.
Correct.
But it does not add significant volume. So people who may be very used to filler in their upper lip and want to replace it with a lip lift, they may not get as much volume as they think they're going to get, and they may still need some filler. Is that correct?
Yeah, I would say that's somewhat correct. I think that the majority of patients who get lip lift procedures on their own are pretty happy with their aesthetics. I think that in a younger patient population specifically, it may replace the need for any filler. If someone's got a very thin lip or an older patient, adding fat grafting or filler at a later date certainly can be used as a combination therapy. I find a lot of our patients are coming in who've had a lot of filler in their lip, and it's probably the wrong technique to augment their lip, meaning they have the wrong anatomy for filler. They have small lips, but long lips, and they're almost hanging the filler on like a curtain being pulled down, lengthening their lip, some filler migration, so they end up with a thicker, longer lip that looks boggy, fuller, but not natural.
Boggy?
So
What is boggy?
boggy just doesn't look like a natural, normal, almost like fluid filled. It just doesn't look like a natural lip. So they've lost some of the configuration of the contour of the white lip, may be distorted. It looks like, they call it filler migration or filler mustache. So it's super common to see people come in. They go, I haven't had that much filler done, but it's probably all spread from their lip into their white lip. And they now have a thicker lip, and it has a certain look to it. The lip almost seems like it's malpositioned. It's come anteriorly. The configuration of the lateral lip relative to the base of the nose seems to be distorted. They often have some filler in the red lip, but the anatomy is distorted. So we start by removing that with the best we can with hyaluronidase, removing it. And then we progress with consideration of lip lifting in stages with the surgical shortening of the lip, eversion of the lip, and then possibly the addition of fat grafting or filler at a later date once we've completed the shortening. But I'd say the majority of patients who get that done, probably 50% are happy with lip lift alone. Some people want to augment it further with potential fat grafting. I like adding fat personally over filler to the lips that we do surgery on.
There are some surgeons who will only do lip lifts on an older demographic. You'll do it on anybody from not in their 20s so much, more so 30s and up, would you say?
We see patients at different age demographic. I think the older patients tend to be sort of home runs.
Yeah.
Most of them are very, very happy. We've had some people with gorgeous results who've been a bit younger, who've struggled with the changes because they may not just be used to the look. They may have gone through all sorts of psychological changes of how they perceive their lips. They've had filler, they may have had some fat put in, they may have had orthodontic work, they may have had veneers and other things in the area that we're talking about in the perioral area. And the lip lifting procedure's got some limitations, as we've talked about. It's really going to be limited in how much it can lift. We've had some people who've done lip lifts that I've thought look amazing, who've wanted to do another one and shorten it even more. So there's a little bit of body image and perception with the upper lip that probably there's some psychological analysis on it that a psychologist would probably be able to sort of dive into why someone would potentially hyper-focus on the area around the mouth. But I think sometimes it's tricky because it's not sort of a totally predictable outcome. It's hard for us to show someone exactly what they're going to get with a lip lift. We can show them examples and make sure they're in line with the type of lip that they're looking for. But the patients that are most happy with it are people who have long lips, skinny lips. They tend to be very happy.
Let's take a look at a couple of patients. So this would be an example of somebody who's got a long white lip, thin upper lip.
Yeah, so she's sort of an ideal candidate for the surgical procedure. Longer upper lip, wants a little bit of dental show. I mean, if she had her mouth a little bit open, you'd probably see that the after has a little bit more of her teeth showing. and it nicely volumized her upper lip and everted it. So she looks transformed. I think she looks gorgeous afterwards.
She does. What is the proper proportion? So is the upper lip is supposed to be smaller than the lower lip? Because some people,
It can be up to 50-50 type of thing, but you don't want the upper lip to be bigger than the lower lip.
Okay. And then my next question is, it looks like this has been shortened more significantly than the volume of the upper lip. Is that correct?
Yeah, it's not a 1-to-1 ratio. So it's not like you take off a millimeter of lip and then you get a millimeter of show. They're not directly, it depends on your tissues and your lip configuration, the elasticity of your tissues. There's a lot of other, that's why you're sort of not totally able to predict exactly what someone's going to get. So we use calipers and we mark it as carefully as possible, but how it's going to settle in and be ultimately, we have to basically is a little bit of unpredictability.
That's an important thing for patients to know, because some people would think, I want 2 millimeters taken off here. They're going to gain 2 millimeters, and it may not. It may not.
On a younger patient base, it may be more correlated like that. On older patients, it's less correlated.
Here's another patient. We just had her in this week. She looks also amazing. A woman in her 40s, and it looks to me she's got a really nice balance of a shortened white lip.
Yeah, it looks great, and she's happy with it. And I mean, most patients don't look quite as good as her at 1 week, but for 1 week post-surgery,
that was pretty
I think
awesome.
she looked awesome, yeah.
Can you create a Cupid's bow?
Well, you're going to enhance the Cupid's bow, so you can't really create it. But if a patient has a Cupid's bow that's a little bit smaller, you're going to be enhancing it because most of the lifting is in the central lip. There is another type of lip lift, which I haven't discussed here, which is basically a VY-plasty, which means all the incisions are done on the inside of the mouth. And there we're basically rolling the red lip from the mucosal surface downwards. It's not going to be shortening the lip, but it's going to be giving you some more volume of the lip without making an incision underneath the nose. That's not as commonly done. And it's not really for long lips. It's for small lips in patients that don't want to have augmentation with filler.
So for those who do have filler and they want to have a lip lift with you, do they have to dissolve their filler beforehand? Because that's probably hard to do, I would imagine, for people who are very used to their full lips, and then they have to dissolve a few weeks before surgery.
I wouldn't say it's absolutely indicated, but it's certainly helpful because we do like to have the lips as close to their natural state before surgery is carried out. I have been a little bit flexible with certain patients who really don't want to remove it all, but if they have tons of filler, I definitely need to remove the majority of it.
And once they've had a lip lift, can they add filler? Can they add fat grafting?
We usually ask them to wait a few months. Fat grafting you can do basically at the same time as a surgical procedure or in a staged procedure. Filler, certainly you can do at a later day once everything's healed up.
And for those who are worried about the scarring that would be under the nose, does it heal fairly well?
Listen, you can do the exact same operation on 2 different people as meticulously and carefully as possible, and people will scar differently. We can't always control for scarring. We're going to do our best suturing possible, and we're going to hope that the scar is ideal. We also offer laser resurfacing and other things in the event that the scar is not optimal. The odd person needs cortisone injection or 5-FU injections to improve their scars. But that being said, scar design, we can control. Suturing technique, we can control. Securing the tissue in the deep layer, which we do on the lip lift, which is what's known as a modified upper lip lift, where the SMAS layer of the deeper lip is secured with deep sutures. We do that on all our cases. So there's as little tension on the wound itself. Leaving the sutures in for approximately a week or less is ideal. You don't want to leave them in for 10 days or longer, or you may get little hatch marks. So we do everything possible. I'd say the touch-up rate of lip lift scarring is low, but it does occur. We just redid a lip lift scar on a patient who had Asian skin. It didn't heal great the first time. We were just in touch with her a second time. The scar is almost imperceptible. So just probably it was under a little bit of tension the first time, and now the second time around there's less tension because everything's healed, and the scar is healed nicer second time around.
So all in all, lip lift surgery, a great procedure.
I think it's an excellent adjunct procedure. I've been doing it for over 20 years. I just happened to train with someone who had it as part of his practice. It was not in favor 20 years ago. It became very in favor with Instagram. And now I think it's like a well-accepted part of the anti-aging paradigm and surgical procedures that many surgeons offer.
Excellent.
Thanks, guys, for listening to Unfiltered episode on lip lifting. We hope you found it informative, and we will see you all soon.